My next guest, Carrie, says she's lucky if she gets more than 4 hours of sleep a night, and it's not because she's burning the candle at both ends. In fact, she says she is desperate to get more sleep because her marriage and sanity are going downhill fast.
I think I'm a freak of nature because I do not sleep.
Dang it.
What person does not sleep? I started having trouble sleeping after the birth of my son in 2008. He was premature and he spent 9 weeks in NICU. So my son did come home. I had anxiety because I was so scared something was going to happen to him on my watch. My son was diagnosed with Crohn's disease last year. Now I don't sleep because anything can happen in the middle of the night.
Another night.
My brain never goes into sleep mode. It's always on. I toss and turn all night. The slightest noise will wake me up. I usually get anywhere from 2 to 4 hours sleep a night. And I've gained a lot of weight since I've stopped sleeping. I put on 100 pounds. Every morning I wake up with a headache. I'm angry and irritable all the time. My husband and I do not sleep in the same bed because any movement he makes will wake me up. Insomnia is destroying my marriage. I feel terrible that I'm putting my family through this. I don't like the person insomnia has created, and I do not want to share my bed with it anymore.
Oh! Well, Carrie is here, and also joining us is our longtime good friend, Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer. So welcome. Glad you're here. So how did you sleep last night?
Really?
Yeah.
Hardly at all.
Not good.
Insomnia, but plus the excitement, and yeah, not at all.
From a medical standpoint, Doc, how often does this happen?
So Carrie is really not alone. I mean, sleep trouble is very common. Long-standing, not just occasional, sleep disorders. Nearly 45 million Americans suffer.
45 million?
45 million Americans. So insomnia is one of the most common forms of sleep disorder here in the United States in particular. So what is that? So insomnia is simply stated a difficulty falling asleep, staying asleep, or the combination of those two things. In order for it to be chronic insomnia, then a person has to experience that 3 nights a week for at least 3 months. So it sounds like this might be what Carrie is experiencing, but she needs to see her doctor for a diagnosis to see what it is. And of course, we should talk about that in a minute.
Okay, so how did you sleep before your son was born? Because you said you had issues and then hospitalization and all. How did you sleep before that?
Like a teenager, I could sleep from 9 to 10 hours. I enjoyed my sleep.
So you clearly have an onset trigger. You know
Yes, sir.
that's what started that.
Yes, that's when all this started.
Loss of sleep can happen for a whole host of reasons. Sometimes people know exactly why, and some people they don't know why, and there are a whole range of causes. Everything from stress and anxiety, as you've described, to things like thyroid conditions or certain medications may cause this. In addition to that, common things that we do, we may not think affect our sleep, like overuse of stimulants, nicotine and caffeine. And then to add on top of that, there are other conditions that can cause loss of sleep, like sleep apnea is another example. And this, as you know, occurs frequently in people who are either overweight or who are obese.
And being a caregiver is clearly stressful, and you know, you had those issues early on, and now with Crohn's disease.
Yes, sir.
So you watch that, but look, if you love your child, and you know you do,
Yes,
and we
I do.
know you do, then you have to take care of your child's mother.
And that's what scares me the most, because if I don't get rest, if I don't get sleep, I'm not going to be at 100%.
Well, no, and you can't give away what you don't have. If you're the only mother your child's ever going to have, and so you have to take the time and realize it's not selfish to take care of you, because you don't want to be emotionally bankrupt, you don't want to be physically bankrupt, and you have to be willing to ask for help, whether it's for other people to help out or support groups or babysitters or family members. You've got to be willing to ask for help.
Yeah, and I'd like to add on another really good reason to pay attention to sleep loss. So, you know, we know that there are a lot of things that happen, and Carrie, you mentioned some, you've just mentioned a few others. Feeling bad the next day, or over time just not being sharp, being less alert and able to deal with things, emotionally bankrupt and physically as well. But it doesn't stop there. So chronic sleep loss or lack of sleep over periods of time actually contribute to very serious medical conditions and can be life-threatening. So it's been linked to diabetes and heart disease. There was a recent study that actually found that adults who get less than 6 hours of sleep a night, 6 hours of sleep a night, over time have a 4 times greater risk of having a stroke. So this is a real health risk beyond the day-to-day risk that you carry. So it's especially important to take this seriously. Talk to your healthcare provider to get a diagnosis. Your healthcare provider may refer you to a sleep specialist to help figure out what is going on. And the good news is that most sleep disorders actually can have effective treatment. There's psychological, behavioral, and/or medical treatments that can be effective in treating sleep disorders. So there's a lot to know about them. This is a very complex area. And of course, for more information on good sleep habits and information and resources for sleep disorders, you can visit gethealthystayhealthy.com.
Interesting, I had a friend that was having this kind of problem recently, and I sent him to gethealthystayhealthy.com, and you guys have a great action list there. There's like 10 points there, and he went through the 10-point list, and it talks about he talked about don't take naps late in the day, make sure the room was really dark at night, and get a wind down routine. Those were 3 of the 10 that he said made a big impact of him that you guys have listed there. So great information, as always.